All right, good morning Queensland and good morning to all of our Facebook Live followers, and it's a wonderful day here in Brisbane in Queensland. Can I start off by saying that we have great news today. We have 0 new cases. It's a double donut day, which is fantastic news. We have 18 active cases at the moment, 1,982 total cases, and we've had 16,613 tests in the past 24 hours. So once again, that's a great sign that people are getting tested. And like I said, it is absolutely significant that as many people as possible go and get tested. So, and in more good news, we've had another good day for vaccine delivery, 21,723 vaccines delivered by Queensland Health. And we now have 51.65% of eligible Queenslanders have had 1 dose and 32.9% have had 2 doses. So it's really important that Queenslanders go and get vaccinated. Yesterday we announced that the Cairns Convention Centre will be opening soon for vaccination. We really need people to go and get their vaccine. This is our window of opportunity to go and get vaccinated before we see another issue arise here. So today isn't just good news, it's a great news day. We have no cases, lots of testing, and of course the vaccine progress is underway. The Gold Coast family who travelled to Victoria have tested negative. That is excellent news. Dr Young is confident that the risks of the 2 truck drivers is low. That's great news. And we know that eventually there could be cases that pop up, so that is why I'm urging Queenslanders to get vaccinated. That is absolutely important. Now, I just want to talk a little bit about hotel capacity. So we've got some more good news there. So as promised, from tomorrow, 50 rooms will become available for people coming into Queensland domestically. Those people are being contacted today. And as we know, we did have a pressure cooker situation. Having that week respite has been really good. So I've just been advised by Queensland Health and by Queensland Police that from Monday we will be available to offer 680 rooms. So that's excellent. That's because we've had the opportunity for that week to ease the pressure, and of course we know that September, October we're going to see less of those international flights coming in as well, which means that's great news that families will be able to come to Queensland. So this afternoon, I'll talk a little bit more about this later, there's going to be a National Cabinet meeting. I'm looking forward to that meeting. We'll be getting some updated information on the Doherty modelling, and of course there'll be a paper circulated, I understand, about hospital capacity. We haven't received that paper yet, but I look forward to getting briefed on that paper. Let me just say this to Queenslanders. My job is to keep you safe. We've had a double donut day today. We've got 0 cases. Our economy is open. We have our Queensland lifestyle. Tonight people will go to their cafes and pubs and local restaurants. 100 people will be able to gather in people's homes, whether that's for a 21st birthday party. People will be able to come together for Father's Day on Sunday. This is the sort of Queensland I want. I want to preserve our lifestyle. I want to see Queenslanders being kept safe, but we need to get our vaccination rates up. This is absolutely critical that we use this window of opportunity to get as many Queenslanders vaccinated, so when the virus does get here, we are well prepared. People know me. I stand by what I believe in, and I will always accept the advice of Dr Young, but I will not be making decisions when I don't see detailed modelling. I'm asking very simple questions here of Scott Morrison and from the National Cabinet. I want to see further detailed modelling. It is only fair and reasonable that we have a constructive debate in this country. And rather than picking fights and attacks, let's have a decent, educated conversation. And there is nothing wrong with asking decent questions about the safety of families. We had a conversation early in the pandemic about aged care, and then we saw how important it was to get our aged care residents and our workers vaccinated. We know that the federal government is responsible for the supply of the vaccine. If we can get more supply, well, then we can put more vaccines into people's arms. And now there is a very legitimate conversation where I'm asking questions about what happens to a cohort of young children who aren't vaccinated. These are legitimate questions that Queenslanders and Australians want answers to. It is not about being against a national plan. We are all for a national plan. I went through yesterday in the Queensland Parliament the national plan, which is clearly articulated, and the phase that we are in, Queensland is doing everything that is part of that national plan. So let's have an educated conversation about these issues. These are real issues, and I think as a nation we can come up with the answers. But rather than attacks, let's have a conversation. I'll hand over to Dr. Young.
Thank you, Premier. So an excellent day. We have no new cases, and those cases we had yesterday, we've contact traced, and we have all of those people in quarantine, and we'll just work through what that means going forward. But thank you to every single person who came forward and got tested yesterday. That is enormously helpful because it means that we can be confident we don't have virus circulating in our community, despite the large number of people who are still coming into Queensland. The other thing I want to thank is our freight workers. Every single case we've had recently that's involved truck drivers, those truck drivers have done exactly the right thing. So thank you very, very much. They are the people who are most vulnerable at this time in getting COVID because they must travel around the country and they must go into areas where there's large amounts of transmission. So when they come back into Queensland, it's critical that they manage their risks to their family and to the community by minimising movement, and they've all been doing that, so thank you very much. Then the other thing we can all do is get vaccinated. Anyone who is 16 years or older should make an appointment to get vaccinated. If you're 60 years of age or older, you need to make an appointment with your GP or a pharmacy and get vaccinated as soon as possible if you haven't already. That is your best protection because COVID will come into Queensland. Of course it will. We're seeing every single day and we don't know when it will lead to an outbreak. The best protection is to be vaccinated. So 60 plus, make an appointment with your own GP or a pharmacy and get vaccinated. If you're age 16 through to 59, then you can make an appointment with the GP. GPs are getting increasing stocks of Pfizer. They also have AstraZeneca if you want to sit down and talk to your GP about that. Or you can make an appointment with one of our many Queensland health vaccination sites across the whole state. That's critical. Now, if you're 12 through to 15, if you have any underlying health conditions, so for instance you have a paediatrician who takes care of you, or you're a First Nations child, or you live in a rural or remote area, it's critical you also get vaccinated, that you come forward and get Pfizer vaccine. That's very important. So if we can do all of that, then when the virus does come into Queensland and start spreading, then people will be protected. We know vaccination is what will protect us. Thank you.
Well, yesterday Scott Morrison had 6 members of his team out attacking Queensland, our border restrictions and our Premier. We haven't seen a pile-on like that since before the state election last year. Not one of them mentioned the outbreak in Sydney. It's as though Queenslanders are somehow responsible for the New South Wales outbreak. It's clear the Prime Minister has both his eyes on his own election and no eyes on the outbreak ripping through Sydney right now. We are committed to the national plan. In fact, in some ways, we're one of the few states that's complying with the national plan. Queenslanders complied with Phase A of the national plan when Sydney-siders didn't, and that's how we got here. Don't let the LNP convince you that the Doherty Institute's modelling says something that it does not. Don't fall for Scott Morrison's marketing tactics. This is much more complex than a number and a simple 3-word slogan. And to Queenslanders, I say this: we've been here before, and every time our Premier has followed the health advice and is determined to keep Queenslanders safe.
Well, thank you to everyone who's come out and got tested in the last 24 hours. We've seen those numbers go up considerably. And once again, Queenslanders are stepping up and listening to the advice to come out and get tested if they have any symptoms whatsoever. It is great news about the family of 5 all testing negative. They will be in hotel quarantine for the next 14 days. So that is really positive news, and I understand the school has now opened back up again. Record numbers of vaccinations by the state, Queensland Health yesterday as well, and we will continue that rollout. But we also remind people that GPs are getting about the equivalent of Pfizer as the state is, so Pfizer is also available through GPs, and also, of course, AstraZeneca through GPs and community pharmacies. And we were the first to ask for community pharmacies to be brought online, and we're the first to have community pharmacies coming online more broadly across our state. And we know how important that is, because Western Australia and Queensland are the most decentralised states in the country. So delivering vaccines in Queensland is far different to delivering vaccines in New South Wales or Victoria. Or, of course, I've seen the references to Tasmania and ACT's rates. So we have to remember, we have to try to take this out into our remote communities. Just setting up big mass vaccination centres on their own is not enough, because we cannot meet our 70 and 80% targets solely in South East Queensland through mass vaccination sites. We need to make sure we're hitting those targets out in our regional and remote and rural communities as well, because we owe it to those people. You can't talk about lifting restrictions and saying, well, South East Queensland's basically seen the target met, and have communities that might sit at 30 or 40%, because you are saying that every vulnerable person, including our First Nations people in those remote communities, don't count as much. So we need to make sure that those vaccinations are as high in our remote and rural towns as it is in South East Queensland. And we know even in South East Queensland those numbers are varying. So everyone, come out and get vaccinated. Please don't wait until we have a major outbreak like Victoria or New South Wales. Now, as far as the comments around 0 to 12-year-olds, it is important to remember that our biggest cluster and the biggest risk to this community was the Indooroopilly cluster, and that was spread through school children in schools. So we know young people are far more at risk of getting it and spreading it, and we've seen transmission at a much higher rate in households, where last year we were seeing transmission of 2 or 3 people in the family. Now we're seeing entire households becoming positive from that one person coming into that household. So it's really important that we do have this conversation, as the Premier said, because of the over 22,000 positive cases out of the New South Wales cluster. Over 3,000 of them are 0 to 9 years old, and of the 0 to 19 years old, that is over 7,000 young people out of the 22,000 who are positive. So that shows that just under 1/3 of all of those positive cases are young people 0 to 19. So it is important to have the conversation. It is important to be talking about the Doherty Institute data in a factually correct way. This is public information. I encourage the public to look at that report and look at the information in it, because I believe the Commonwealth have been misleading and too simplistic in their quotes in relation to that report. It isn't as simple as meeting a target. There's a whole lot of other factors. But I will say this about the national plan. Queensland has led the way. The national plan reflects Queensland's plan that has been followed throughout the pandemic and has been successful. And we know it's been successful because that is now replicated in the national plan, and we welcome that. Again, I encourage everyone to keep coming out, getting tested and getting vaccinated, looking out for their closest site to get vaccinated. Register on the Queensland website. We have bookings becoming available. National Health Ministers met again last night. We're advised that more vaccines are coming, so we want people to get registered so we can get them booked in and get people vaccinated as quickly as possible.
So just to start with, operationally, yesterday we met 6,497 vehicles that crossed our borders. 115 were turned around. Of that, 3,886 were actual vehicles, not heavy vehicles, and most of them were cross-border entries into our state. Our flights, we processed 180 persons, turned around 2 and placed 52 into hotel quarantine. We only saw one border breach yesterday where we had to take enforcement actions and no arrests. And can I just finish off by saying too that, as the Premier announced, we are moving to a new system next week once we switch back on fully our hotel quarantine for domestic arrivals. For all of the people that are looking to get in that have been paused, please make sure that they engage with Queensland Health's website. We will put out messaging. There is work still underway to make sure that that process works effectively. People need to understand that they will still need to arrive with the correct paperwork. I would hate to think that people have had to wait and then they turn up with the wrong paperwork that's now out of date. So it's very important people stay engaged with that, and we'll push out that messaging in the coming days. Thank you.
Premier, you talk about having an educated conversation.
Yep.
Your comments in Parliament go against the advice on your website about young children. What is the actual medical justification, apart from overseas news reports, for those statements about every child being at risk?
Well, I actually put it to National Cabinet, and National Cabinet agreed to get some work done on it. So it's not new, Tim. And even the Prime Minister, even the Prime Minister himself, when he was asked, he said, when we have advice which says we can safely vaccinate children under 12, and it's not clear that that will be the case, but if it is, then we'll obviously proceed to do that. But it's an important priority for us. That's the Prime Minister's own words.
So you stand by your statement that every child is at risk if the Delta variant comes?
What I said and what I maintain is that at the beginning of this pandemic, we were very concerned about the elderly because they were unvaccinated. So what did we do? We went on we put a lot of effort into getting our aged care, our seniors vaccinated, and that was a priority, right? Now what we are seeing in evidence that's happening in the US, where it is the pandemic of the unvaccinated, a lot more children are presenting with COVID and a lot more children are ending up in ICU. I don't want to have that happen here. So that's why I'm just saying, that's what I am saying very clearly, that, and there is actually some trials happening now, I understand, with some of the pharmaceutical companies over there for children. So what I'm saying is, let's have a conversation about it, and the Prime Minister himself at National Cabinet, they agreed to go and do some more work.
Premier, you've been accused
Yeah.
of scaremongering though.
Not at all, not at all. No, I think this is about protecting Queenslanders and having a conversation about what will we need to do. And, you know, there's measures that other countries are putting in place. For example, if the Delta variant is going rampant through a particular region or a city, the children in primary school are wearing masks as a precaution. So what do we need to do? I'm just talking about, let's have a conversation about it, because it's just like when we were concerned about the elderly, there is now another group of people. So it's about having an educated and responsible conversation.
But you presented those with the elderly was the fact that they were more susceptible to severe disease, not the fact that they were unvaccinated. Isn't the advice to young children that they're not more susceptible to severe disease?
Well, what they're seeing, unfortunately, overseas is that they are seeing some more presentations. So it's an issue, and National Cabinet has agreed to look at this issue. That was a decision that was taken at the last National Cabinet meeting.
Your concerns are legitimate. Does it concern you then that your federal colleagues in Canberra are keen to distance themselves from your commentary?
That's a matter for them. I will stand up for this state. Queenslanders know me. They know our team. And I think you only have to see the work that Queenslanders are doing themselves, where we have 0 cases in our community. I really feel for people in New South Wales and Victoria. Can I say this is a really tough time? And I look forward to the day when we can all open up. I look forward to the day when we can all go back on an overseas holiday if we can. I look forward to the day where families are reunited. And through the vaccination program, this is our opportunity to be able to do that. But we are not at 70 and 80% yet. In terms of where we are at the first phase of the national plan, Queensland is doing everything we can to actually comply with that plan. And as the Health Minister said and the Deputy Premier said, the national plan is actually following what we have practiced here in Queensland: early, stringent and short lockdowns if outbreaks occur. Look at the great work that Queenslanders have done in relation to containing that Indooroopilly cluster. That was amazing. That was absolutely amazing. And, you know, the way we are at the moment in this state is a testament to the hard work of every single Queenslander. And now I'm asking every single Queenslander to go and get vaccinated, who is eligible. Please go and get vaccinated. This is your window of opportunity. And I say to the federal government, give us more supply of Pfizer and Moderna and we will get that out.
Your own website says reassuringly data from the UK suggests admission rates for children have not increased.
Tim, you lived in the US. I mean, you went through, you saw the pandemic firsthand. You know, you saw what was happening over there where people weren't getting vaccinated. And now there is evidence coming out from a whole range of states where there is concern about young children. I'm just saying we need to look at this issue. And I think you've got young children yourself. Many people in this room have young children.
You talk about giving Queenslanders the whole picture, but those figures you said in Parliament and tweeted were the worst case scenario without contact traces. How is that?
But they are worst case scenario. I think this is where I think everyone needs to have a look at the Doherty modelling. They need to look at best case scenario and worst case scenario. Today, I think we're going to have a really in-depth conversation about hospital readiness. I mean, what we are seeing in New South Wales is there is going to be a huge capacity drain on their hospitals over the next... The month of October is going to be a very serious time for people in New South Wales. This is a big issue, and nationally we are all committed to helping New South Wales and Victoria as their hospital capacity gets stretched. Sorry?
Is that ever going to be a way to safely open up going forward while accepting there are going to be deaths like in New South Wales and Victoria that have already said they're not going to get to zero?
Well, we've had 7 people pass away here in Queensland. There have been deaths in Queensland. There will be deaths across Australia and worldwide, tragically. I mean, this is an awful, awful virus. This is something, you know, we don't want to see our hospitals overwhelmed with. So we are following this national plan. I went through in Parliament yesterday the current phase. Queensland is doing everything that is here as part of the national plan.
In 2019,
Yes.
Queensland Health reported it was 264 deaths directly related to influenza. Is that the sort of level of deaths the government would be comfortable with reopening?
Look, we're not at that stage yet. We're getting further modelling as well. You know, and can I just say, we don't know what the future holds. We don't know about the new strains, the new mutations. There wasn't a Delta strain 6 months ago. This is all new to us. And, you know, we are doing everything we can, and I'm taking the best health advice from, I believe, the best health officer in the country to keep this state safe.
That new research you've asked for.
Sorry?
Sorry, that new research you have asked
Yes.
for from Doherty Institute, when do you expect that to receive?
I don't know. We'll follow that up. Yeah.
Given your concern
Yeah.
with kids and COVID, will you be mandating the teachers to get the vaccination?
Look, we are encouraging teachers, and that's a really good question. We are encouraging teachers to get vaccinated, and that's why we need parents to get vaccinated as well. The more people we get vaccinated, I think we will see less likelihood of the spread of this COVID disease.
Premier, Queenslanders have made it pretty clear their thoughts about NRL families being allowed in and sports families being allowed in, while Queenslanders themselves have been locked out. Have you heard that message?
Yes, I have, and I apologise. It was not the right thing to do when we had the pause. It shouldn't have happened. Unfortunately, it did happen, and I extend my apologies to the public about that. As we've seen, we've been working very hard over the last week, police and health, to get those that pressure cooker of the hotel caps down, so we can actually now have more families be able to come into Queensland. Sorry?
It was the wrong decision to let the NRL in.
It shouldn't have happened when we had the reduction happening in our hotels.
And how
Yeah.
did you suddenly get 680 rooms?
Sorry, because people have left those rooms and we're having less international flights coming in, so that means we've got the capacity.
Premier, we've had Parliament all week. Why
Yeah.
didn't you say earlier this week that letting NRL in was the wrong decision?
Because we were talking about other issues at the time.
You also got asked about the NRL.
Sorry?
You also got asked about the NRL during...
I don't have the exact question on me, sorry.
And you said
Yeah.
that they were, like, the sporting teams were out.
Yeah, they were outside the cap, but I can understand that Queenslanders could see that in the light of when we were actually trying to reduce the number of people coming in, it was not the right look, okay?
Premier,
I accept that. I accept that.
I know you're big
All
on
right?
your Facebook followers. One was watching today, Sharon Gordon. You may be familiar with her case. You mentioned it in Parliament. She's been given an exemption, but now
Yes.
she has to go back to Sydney to fly back in, even though she's only 5 kilometres from the border.
Yeah.
She has to go back into a hotspot to actually fly back into Queensland. Can
Yeah.
you tell Sharon, who's watching, why is it this hard?
Yeah, well, look, I'll say to Sharon that I want health to work with her to make it easier for her to get here. I think that's really important, and we will work with her, okay?
From your family, the Tweed Council's been asked to set up a refugee camp for displaced Queenslanders over the border.
Yeah.
What do you have to say to those thousands?
Well, I say to the Tweed Council, we are trying our hardest. We have put a proposal to New South Wales to have those checkpoints to keep those communities closer together. I would really like that to happen, but unfortunately, there does not seem to be movement from the New South Wales end.
Will reconsideration be given in the future if there are outbreaks for NRL sporting codes to come into the state?
In terms of,
Quarantine.
if we had, I think, because we had that pause, we shouldn't have had anyone come in, but now that pause is lifted and there are bubbles that have been put in place by those sporting teams. And let's just be realistic too, that it wouldn't be happening unless they were allowed to come in and play as well. There would be probably no sport for people to watch. Yeah, thank you.
Can I ask you about the dropout? Sorry, yesterday...
Which one? There's quite a few of them.
The one you're trying to find.
And I'm trying to find.
You came from Sydney, that was on the Gold Coast?
Windaroo,
Yeah.
that one? Yes.
Yeah. Have you, I think yesterday you said you were testing his family. What are
Yes.
the results?
Yes, so far, last night's results of his immediate contacts are all negative.
What sort of level of death are you comfortable with in terms of COVID?
Comfortable with? I'm a doctor. None.
I mean, with influenza, there was about
Well,
360 to
come on.
That's something that we...
Can you please remember who I am? I stand up here every day, but ultimately I went into medicine to save lives. I'm not comfortable with any deaths that are preventable. So that's why I want every single Queenslander who can be vaccinated to get vaccinated, because that is the best protection. And that's why I've spent the last 19 months doing everything I can. And thank goodness I work with a Premier that we have here and a Cabinet to stop the virus coming into Queensland. So
You're making political decisions about...
I'm not making political decisions. I am making... No, sorry, you've got me quite upset now. I do not want to see any death of a Queenslander that is preventable, whether it be due to smoking, due to obesity, due to high alcohol intake, due to accidents that could have been prevented, due to road trauma. I could go on. That is what I have just spent the last 16 years of my life working on. So
Let me rephrase my question.
I don't want to see any deaths.
Are you comfortable with death? I mean, comfortable opening up with restrictions? At what point?
when every single Queenslander has been given the opportunity to be vaccinated. So it is up to individuals to choose whether they wish to protect themselves. And people make choices about a whole range of things every single day. So once every single Queenslander who is part of the vaccine rollout, who's eligible, which today is some 12 to 15 and all 16 plus, once they've had that opportunity, of course, then we make decisions. But I would not want to see the virus coming into Queensland without mitigating factors until that's happened.
Is that all? Thank you very much.